Om Swastiastu. Hello, we are from Sgd B3 and today we will explain our student project Polyhydramnios. My name is Kevin Andrian Candra with my last JIT number 095. We will start from chapter 1, background. Pregnancy is a happy occasion and it is be important to aware of the potential complication that can occur including polyhydramnios. Polyhydramnios is a serious condition involving excess amniotic fluid around the fetus. The cause can be idiopathic or caused by fetal abnormalities, maternal health conditions, or multiple pregnancies. Symptoms vary and without treatment, polyhydramnios can increase the risk of preterm labor and cesarean section. It is important to diagnose and treat polyhydramnios effectively to improve pregnancy outcome. With a better understanding of the cause, diagnosis, and management of polyhydramnios, we can work to improve our pregnancy outcome and the health of affected mother and babies. Problem formulation is what is the definition, epidemiology, etiology, pathophysiology, symptoms, diagnosis, classification, risk factor, treatment, prognosis, and complication of polyhydramnios. The objective is the same as problem formulation, and the benefit is increase to the knowledge about polyhydramnios and to understand polyhydramnios. We hope this student project can become a reference for future related research. That's all from me. Thank you.
Hello everyone, my name is Aisyah Taqiyyaa with your last JIT number is 076. 2.1 Definition of Polyhydramnios. Polyhydramnion is the excessive accumulation of amniotic fluid around the fetus in the womb during pregnancy. Amniotic fluid functions to prevent the fetus from injury while providing space for movement and growth. This fluid consists of important components such as nutrients, hormones, and antibodies that can counteract infection in the fetus in the womb. However, if the amount of amniotic fluid in the uterus is too much or too little, complication during pregnancy can occur.
Okay, hello, my name is Wilbert Purnamasidi. With last digit of my student number is 135. Thank you for the opportunity. And now I will explain about 2.2 epidemiology of polyhydramnions. I have several points at this subtopic. The first one is occurrence. Until now, polyhydramnions affect about 1 to 2% pregnancies around the world. The second point is incidental diagnosis. So this disease is often identified incidentally during third semester by sonographic evaluation. And the third point is idiopathic nature. This disease is typically self-limiting, but underlying causes may be discovered postnatal. Association with pathology is 91% of severe cases have identifiable disease or congenital anomalies. And the next point is perinatal mortality rates twofold increase. People who has polyhydramnios twofold increase compared to normal amniotic fluid volumes. The next point is preterm delivery implication, which independently associated with higher perinatal mortality and intrapartum morbidity. And the last one is risk factors, especially comorbidity. The most comorbidity of this disease is diabetes, hypertension, especially severe pregnancy-induced, multiparity, congenital malformation, previous perinatal death, and low gestational age. Maybe that's all from me. I give it to my friend. Thank you.
Allow me to introduce myself. My name is Carla Noveline Manullang with my last three digits are 146. And now I'm going to present about the etiology of polyhydramnios. So the most common causes of polyhydramnios is idiopathic. Idiopathic polyhydramnios is defined as polyhydramnios or excess amniotic fluid volume, which is not associated with common causes of polyhydramnios, such as congenital fetal anomalies, maternal diabetes, isoimmunization, fetal infection, placental tumors, or multiple gestation. Excessive production or decreased uptake of amniotic fluid can cause polyhydramnios. Excessive production may result from increased urination by the fetus or increased transudation of fluid from exposed fetal surfaces, while decreased uptake may occur from decreased swallowing of amniotic fluid by the fetus. That's all from me. The next part will be continued by my colleague. Thank you.
Hello everyone, my name is Dewa Agung Guptha with the last three digits of student's number 072. Okay, So today I'll be explaining you about the pathophysiology of polyhydramnios, but first we got to understand about the balance between productions, resorptions, and secretions of amniotic fluid that is really crucial for fetal development. Initially, amniotic fluid is mainly produced by the placenta and fetal amnion membrane, but as the pregnancy progresses, the fetal kidneys become the primary source of amniotic fluid productions. Other fetal organs such as urogenital and respiratory tract also contribute to maintaining amniotic fluid volume. Disruptions in this process can lead to issues like excessive accumulations of amniotic fluid. But common cause of these disruptions include problem with fetal swallowing, reabsorptions, or increased urine productions. But we gotta understand that monitoring fetal urine productions and absorptions is really essential for ensuring proper amniotic fluid volumes and fetal health. That's all for me. Thank you.
Hello, my name is Joseph Adrianus. My student ID 104. I'll explain what the symptoms of polyhydramnios. First is maternal dyspnea, which makes the situation hard for the mother to breathe normally due to the accumulation of amniotic fluid that enlarges the uterus. It'll push the diaphragm. Next is preterm labor, which occurs due to excessive stretching. It'll make the uterine wall inflamed, which increases the risk of preterm labor. Next is PROM, which is also caused by excessive stretching. Inflammation weakens the fetal membrane and can make the amniotic fluid leak out. And then there's abnormal fetal presentation, which happens because of the lack of resistance from excess fluid, which can make the baby move freely. And then there's cord prolapse, which occurs because umbilical cord can slip through the baby's head during labor. It can also be compressed between the baby and mother's pelvic. And the last one is postpartum hemorrhage.
My name is Nandhita Naaz with the last digit of my student number 189, and now I will explain about the diagnosis of polyhydramnios. Diagnosis of polyhydramnios consists of medical history, physical examination, and imaging studies. In the medical history, important information is needed such as previous pregnancies, medical conditions, medications, and history of fetal anomalies. On physical examination, it is necessary to check whether there is maternal abdominal tightness and lower limbs swelling. Lastly, imaging studies can use ultrasound to quantify amniotic fluid and assess the degree of polyhydramnios.
Hello doctors and friends, my name is Natalia with the 3 last digit student number 109. Now I'm going to present about classification of polyhydramnios. Polyhydramnios is divided into 3 classes according to the amniotic fluid index or AFI. The first one is mild with AFI level of 24 to 30 centimeters. And then the second one is moderate with the level of AFI 30 to 35 centimeters. And the last one is severe with the AFI level above 35. AFI itself is a strong predictor towards congenital anomalies and adverse fetal outcomes, and the risk stratification of women with polyhydramnios plays a vital role in identifying the high-risk fetus for further antenatal tertiary referral. It means that an increasing AFI is closely associated with a higher incidence of adverse composite fetal outcomes, leading to a need of tertiary care and delivery, especially in severe cases.
Hello, my name is Gede Saputra with the last 3-digit number of name 018, and I would like to discuss with you guys about the risk factors of polyhydramnios. The most common cause of polyhydramnios is idiopathic, meaning the exact cause remains elusive after diligent investigation to rule out other possibilities. As discussed above, fetal swallowing plays a crucial role in regulating amniotic fluid levels, where a malfunction in this process, known as a swallowing defect, is the most frequent fatal cause of polyhydramnios. When the fetus is unable to swallow amniotic fluid adequately, it accumulates in excess. Infection can also disrupt the balance. Intrauterine infections caused by torch complex such as toxoplasmosis, rubella, cytomegalovirus, herpes simplex virus can lead to polyhydramnios. These infections can affect the fetus development, including its ability to regulate amniotic fluid. Chromosomal abnormalities, birth defects that may involve the structure of number of chromosomes can also contribute to polyhydramnios. In some cases, these abnormalities may affect the fetus abilities in process fluids or cause structural malformations that alter the amniotic sac. Urogenital disorders, problems with the fetal urinary tract or genitals can be another factor. If the fetus has difficulty urinating or there's a blockage in the urinary system, it can lead in an overproduction of amniotic fluid. Neuromuscular disorders affecting the fetus nerves and muscle can also play a role. These conditions may impair the fetus' ability in swallow or control bodily functions, potentially leading to polyhydramnios. Thank you.
My name is Gede with regards to the number 193, and now I will explain about the treatment of polyhydramnios. For the management approach, it depends on the severity of the cases. Mild or idiopathic cases typically requires no intervention, while severe symptom case one consultation with a maternal fetal medicine specialist. Regular ultrasound scans are conducted to monitor fetal growth and plan for delivery, preferably at tertiary facility. For the symptomatic treatment, reductive amniocentesis may be performed to alleviate discomfort, although the recurrence of the polyhydramnios is possible. Indomethacin may be cautiously prescribed for severe case at risk of preterm labor, and delivery timing and mode are determined by various factors, with careful monitoring during labor and consideration of cesarean delivery depending on the circumstances. So from me, next part will be continued by my colleagues. Thank you.
My name is Ningrum, and I will explain about the prognosis of polyhydramnios. The prognosis of polyhydramnios depends on the severity of the disease. The prognosis is good at mild level and worsen with the severity of the disease. Most cases are self-limited and usually do not require any intervention to heal. Several studies have shown that idiopathic polyhydramnios increase the risk of labor induction and placental abruption. Likewise, the risk of shoulder dystocia and postpartum hemorrhage increase based on the result of research analysis. But until now, there is no data that consistently show the rate of intrauterine fetal death due to polyhydramnios.
Hello, my name is Margaretha Jesslyn with my last sheet number is 248, and now I will present to you complication of polyhydramnios. So the first complication is gestational diabetes, and then hypertension, postpartum hemorrhage, and then challenge during labor due to abnormal fetal presentation, and then risk of placental absorption, and then congenital abnormalities such as gastrointestinal obstruction, and then respiratory distress, and then increase the likelihood of preterm birth, and then exacerbating neonatal morbidity and mortality rates. Thank you.
Hello, my name is Carla, and my last reading number is 016, and I will conclude this topic. So polyhydramnios is an excessive accumulation of amniotic fluid during pregnancy, affecting 1 until 2% of pregnancies, and often detected during third trimester ultrasounds, and can have severe clinical implications that leading to increased risk of perinatal mortality and intrapartum morbidity. And polyhydramnios typically arise from idiopathic origins with potential causes including fetal swallowing defects, chromosome abnormalities, maternal diabetes, and twin pregnancy complications. And polyhydramnios manifest symptoms such as maternal dyspnea, preterm labor, and abnormal fetal presentation. And diagnosis of polyhydramnios involves a comprehensive approach using medical history, physical examination, and ultrasound imaging with parameters like SDVP or AFI used to classify the severity. And polyhydramnios can be classified based on the severity. Those are mild, moderate, and severe. And treatment strategies also ranging from observation to specialized interventions like reductive amniocentesis and indomethacin administrations. And the prognosis also depends on severity, with mild cases having better outcomes, while severe cases increase risk of complication for both mother and fetus, including labor induction, placental abruption, and postpartum hemorrhage. And polyhydramnios can also lead to other complications such as hypertension, and then abnormal fetal presentation, congenital abnormalities, and increased likelihood of premature delivery, contributing to elevated rates of newborn morbidity and mortality. And so for the advice for patients with polyhydramnios, it's really crucial to follow healthcare provider recommendations, including regular monitoring, adhering to dietary or activity restrictions, attending appointments, and seeking assistance for any concerns, while also focusing on maintaining a healthy lifestyle to benefit both maternal and fetal health. That's all from me. Thank you. So that's all from our small group discussion B3. Thank you for the attention and the participation, and I do sincerely hope that the information shared has been valuable to all of you guys. Thank you.